a woman within your reproductive age from the age of 21 to the age of 65. Today, we're going to be talking briefly on pap smear, that is the cervical cancer screening test. If you're between the age of 21 and 29, you need to get your first pap smear done. What is pap smear? Pap smear is a screening procedure that checks the abnormal cells on your cervix. And the cervix is the lower part of your uterus, that is your womb, towards the opening of your vagina. How does this pap smear work? During the test, a healthcare provider uses a small brush or a spatula to gently collect a cell from the inner part of your cervix. And those cells can then be examined under the microscope to check for abnormalities like cervical cancer cells and infections. Who should get a pap smear done? If you're between the age of 21 to 29, you need a pap smear done at least every 3 years. If you're between the age of 30 to 65, you also need a pap smear done every 3 years or every 5 years, if in combination with HPV testing. If you're over the age of 65 or after a hysterectomy, that is removal of your womb, then you may not need a pap smear. So as long as you are a woman within your reproductive age from the age of 21 to the age of 65, you need a pap smear done. Here are reasons why you need your pap smear done. Number one reason is for early detection of abnormal cells that can transform or lead to cervical cancer. Early detection would also lead to the second reason why you need your pap smear, and that second reason is preventive care. If to say you have done the pap smear and it was able to detect some abnormal cells, that means you have given yourself a chance for early treatment, so you can stop the cancer before it gets too serious and before it spreads to other parts of the body. Number three, it is a quick, easy and painless procedure. It can only take a few minutes. It is also non-invasive. Number four, to help maintain your reproductive health by identifying infections, inflammations and other conditions that can affect fertility, even conditions such as HPV virus. The pap smear can help detect this, which is a sexual transmitted disease. Number five is empowerment through knowledge. By getting to know your health and well-being, you are in better control of your health and you have a better peace of mind. Because this is a sensitization video and creation of awareness, I'm going to tell you the complications of this cervical cancer screening. Number one is mild discomfort. Mild discomfort that can come during the actual procedure, of which you can ask the healthcare provider to give you a moment to wait so that you can feel a bit more comfortable to carry on with the procedure. And this discomfort should not last long. Number two, light bleeding or spotting. Because we are going into your cervix, it is normal for some people to, have a light bleeding or spotting afterwards, but it should stop within a day. Number three is infection, and this is in a very rare case. By going in there, we could introduce bacteria, which is very rare. But if this occurs, how do you know you have an infection? You might start having some discharge, unusual discharge or unusual pain in your lower abdomen. Number four is inaccurate results. Sometimes the test may miss abnormal cells or show a false result, but a follow-up test can help to correct this and clarify it better. Number five is emotional stress. Some people feel very anxious about the test. Number six is injury, and that is very, very rare. So just know that these complications are very rare, but if you do experience any, feel free to talk to your healthcare provider. How to get your appointment for your pap smear? Just ring up your doctor or your GP practice, ask to book you in for a pap smear, and they'll be more than willing to do that. Do well to share this video. Let females between the age of 21 to 65 get to see this video and encourage them to do their pap smear. And if you have done yours, do well to just give a comment on your experience.